Why did the AHPPC decide against making this compulsory?
Well, it was based on the information that was available to the AHPPC at the time, and there remains a question as to whether the vaccine effectively prevents transmission of the virus, and that would be the reason that you would make it compulsory. There is more information starting to come through, and the AHPPC have said that they will keep this matter open and make a decision if that's what the information, the medical advice and information shows. So it remains an open matter, but at the point in time when the AHPPC met, considered that particular issue, the question remained at that point, and still remains, as to how effective the vaccine was at preventing transmission.
There's some evidence out of Israel just in the last couple of days, and I know it's not concrete evidence and it hasn't been published yet, that the Pfizer vaccine is more effective than stopping transmission. Now, is part of that the reason why the Pfizer vaccine is being rolled out to aged care, or will it be a mix?
Well, the reason we're using the Pfizer vaccine is because that's the one we have first, and these people are our priority. The frontline workers that we've been talking about, the residents in residential aged care and disability care, and also the workers that support them. They are the highest priority. We have the access to the Pfizer vaccine first. That's why we're rolling it out to them first. The majority of aged care residents will get the Pfizer vaccine, and workers and frontline workers. But there may be some, depending on circumstances, that do access the AstraZeneca vaccine. And we must remember that at this point in time, the whole focus is protecting senior Australians more broadly, and both vaccines are very effective at that.
If aged care workers decide not to get this vaccine, will they still be able to give face-to-face care in aged care homes?
Well, again, that will come down to the health advice from the HPPC. That's why we're prioritising the rollout this week to the residents. They are the ones who are most vulnerable, and so giving them the vaccine and commencing that process of providing protection to them is very, very important. And if we continue to get strong uptake, which is what the indications that I've seen so far are from the providers that have given some indications, strong levels of interest and desire to have the vaccine, that protects the residents against serious illness and disease, and that's the most important thing for us at this point in time.
Is there no health advice to date so far about that face-to-face care and whether that stops whether you're vaccinated or not?
Well, we have a range of precautions in place within residential aged care facilities already, particularly in circumstances where there's community transmission of the vaccine. But all of the things that we've been practicing for the last year, hand hygiene, sneezing into your elbow, maintaining a social distance, all of those things should be maintained while we learn more about how what the effects of the vaccine is, how it works, and its strength with respect to preventing transmission. So we need to maintain all of those disciplines. Maintaining our focus on infection control within aged care facilities is something that we will continue to do. It's a strong focus. We're working with the states on that as well to maintain that level, to strengthen the training within residential aged care facilities around infection control. We've learned how very important it is for COVID, but it also has impact for other things like gastro and the flu. And so maintaining that discipline, I think, is going to be something that's will be a continuing feature of the delivery of aged care.
What do you expect the uptake to be among staff in aged care centres?
Look, I'm hoping that it's high, and that's the indications that we're seeing so far. Not just in aged care, but I think that there's a great anticipation in the community. Today's a really important day that we start vaccinating, that we start protecting those that are most vulnerable. But as we gain access to more supplies of the vaccine, we can expand the rollout to other groups within the community, protect ourselves, hopefully protect against community transmission and get back to a more
But Minister, is there a goal in mind for staff at aged care centres? Is it 100%? Is it 95%? What's the goal?
Look, I would urge every person who works in a residential aged care to take up the vaccine. The HPPC will continue to monitor the information that comes back to us from other jurisdictions. You've mentioned Israel, but we're also talking to our colleagues in the UK about what they're seeing with respect to transmission. And if it is the circumstance that a strong uptake or a strong level of vaccination will prevent transmission, the HPPC will reconsider its decision with respect to compulsory vaccination or otherwise, in a similar way that we've done with the flu.
Okay, and that uptake is relatively high. The million-dollar question, I might say, Minister, is what happens after this vaccine rollout is complete in aged care centres? When will that be complete, and does it mean that we can visit our grandparents as much as we want?
Well, we're aiming to get through the first round of vaccinations within 6 weeks, and we know that the Pfizer vaccine provides a level of protection pretty quickly after the dose is administered, so that's great news. We want to be able to have the operation of our aged care facilities coming back to normal as quickly as possible, and I know that's one of the aspirations that residents in aged care are already talking about. They want to be able to go back out for little trips, opportunities to get out, have friends and visitors come back in and see them. So they're all looking forward to that. And so the rollout of the vaccine is a serious enabler for that. And as we work our way through the community, that will become more possible.
So just to be very clear on that, if you're vaccinated, if you live in an aged care home, will you be able to go outside and go on those excursions, as you explained?
Well, that's what the residents are looking forward to being able to do. At this point in time, based on what we know about the vaccine, it protects the person who's been vaccinated. We're watching very, very closely the issues around what it does with respect to transmission. And as we learn more about that, I think that will be one of the things that opens up the opportunities for people to move more freely.
Okay, so not quite yet. You need more evidence. Is that what you're saying?
Look, I think we do. We're very, very early in the process here in Australia at the moment, and as you've said, we're only just starting to see some evidence coming from other jurisdictions with respect to what it does in relation to transmission. And the thing that we really need to keep at the front of our mind is we need to protect these older Australians who are in residential aged care facilities, because they are the most vulnerable people in the country.
Now, I know you caught a bit of a glimpse of Jane then. We were lucky enough to have her on the program. She said she didn't recognise the Prime Minister. She apologised to him very publicly this morning, but she's urging everyone to go out and get the vaccine. She seems to be a bit of an influencer, Richard Colbeck. I've just got a message here from one of our wonderful viewers, Rod. He said, she's a wonderful Australian, such an inspiration. I'm 68, was a bit apprehensive about the vaccine, but now after watching the interview this morning, I'll definitely go and get it. She seems like someone you need on your books.
Look, she was fantastic. I have to say I really did have a smile. She's learned a bit about the direction of her hand signals, which is great. But the important thing that she said this morning was that, you know, no side effects for her. And I know that that's been something that people have been concerned about. We know that the vaccine will protect her now that she's had it, and she's having no side effects. She looked really sprightly this morning. It was great to see her in such good form, and the fact that she was looking forward to catching up with a friend as well. So really pleased to have had to see her yesterday get the jab and be in great nick today.